Reyo Foundation, an NGO with deals with supporting people with autism and special needs, has put up a 2-day show for special people in the society. The show took place on Friday, April 28th at the University of Ghana Medical Center and April 29th at AH Hotel, East Legon. The show brought health professionals, teachers, schools, and experts from Europe together to interact and share experiences on how to deal with autism or other special needs. Anna Otto is the director of Reyo Foundation and the organizer of the Autism and Sense Show Ghana. In an interview with Nation One TV, said that the show is being organized to create awareness and to train the major stakeholders in dealing with autism and other health conditions, especially health
What
professionals.
is really autism? Because I know another person's child who can talk. My one cannot talk. My one repeats everything that they say. Another person is that they don't sleep. It's all different. So how could a parent know how to support their own child? You see, what are the differences? And that is a very huge issue for parents. So all that we are planning here, both in Ghana and in UK, is what we're trying to develop something called family-centered approach that is going to be talked about a bit more. So if everybody is trying to support me and my child who is special needs, but there's so much out there, but I feel that I'm not getting it. You understand? How do we develop a system whereby parents can get that support? Not only parents in Accra, not only parents in UK, but parents who are in the villages in a way, to be able to get that kind of support that is always out there. You understand? So that is the system that I feel it is needed. For we as parents, I'm talking from a parent perspective, we need to get all the support from the professionals together so we can see that it's benefiting us. See, we need to see the support from all professionals to see that we parents are benefiting. One of the most important things is that when you're a parent, you think when you see a therapist, your child is cured. That is one thing. It doesn't, your child will not even need only one therapist. My son needs a team of about 9, a multidisciplinary team to work to, some dealing with his communication, some dealing with his self-help skills, some dealing with his behavior, some dealing with his sensory issues, you see. So how do we put all of it together to be able to support families? How do I explain that in local Ghanaian language for them to understand? How could families support siblings, even the next door neighbor or the friend or the market woman or someone? So that is what we need, so that we get that support, so that we are not alone, and people will be sympathetic with families and support them all the time, not really stigmatizing families. So that is how to relate to them, how to support and give them the treatment so that they will be able to take it. So we need to let our healthcare professionals become more aware of, of the signs to look out for, how to support individuals and families who have autism or other special needs. Yeah. Be able to give healthcare professionals that tool, and then to be able to work with families in the community and to link up with schools and caregivers in the community. In that case, we create a more holistic support and a more community. Meka no twi mu na ye ma menom ne adofo a omo nte brofo no metimi a kyerehye mu amate ase. Me ye frɛ me Hana Otu na me ba e wo autism. Omo hu so wo ya ayi na e frɛ no autism no wedi mfie mienu pɛ. Sesi a wedi 21 mfie eduonu baako. Na me wo London ebroche a me ne wo mo twentwem a ye bebo modi ase ye be ma se de ye kyerehye nkola we ya de se de bo awofo ama nkola na etimi enyi etimi abenya ye ni papa ane ometimi aye bibi dache. Nti sesi a no maba Ghana ye bibi e friend autism and special needs show. Ene ye wo University of Ghana Medical Center. Ya ba se ye ba be kyerehye omo a doctors, any nurses, any therapists, any psychologists said ye omo be hu etimi aboa mo awofo a mo ma omo sa special needs. Because to the bia obekọ doctor ho nurse oba ne akola bone won tell so na ntisa ebi ka no ye onti asemase ne said ni no yare ne hane no nti ye church mo so tumi aboa mo na china Saturday no ye ko age hotel. Hono awofo doctors, teachers, obi abɛwɔ hɔ no a yɛbɛbɔ mmɔden ase yɛbɛkyerɛkyerɛ obiara ahwɛ kwan a yɛbɛtumi abom aboa na yɛtumi aboaboa yɛn adesua mu yare mu ɛne obiara even obi kora ɔwɔ makɔla kora market kora no yɛbɛtumi akyerɛ no ma ne hu sɛdeɛ ɔbɛboa asopɔto families no nti yɛnsuasua ɛnyɛ nipa baako adwuma yɛhia obiara sɛ yɛbɛbom wadamfo w'abusuafoɔ wo neighbor obiara nsua ne yɛmmoa because yɛmma no ɔma ben ɔmo nimadeɛ ɔmo gyina ewiase mu yɛ nɔɔma kɛseɛkɛseɛ na ɔmo wɔ saa yare bi bɛwɔ sɛ yɛboa wɔn fi nkɔlabrɛ nti mesrɛ mo ɛnyɛ biribiara na ɛbɛka sɛ bia ɛyɛ abɛyɛsɛm yɛkɔyɛ sei daabi mpatwɔ yɛhia sɛ yɛbɛboa yɛn ma no nti yɛn na yɛn mum ne ɛnyɛ saa mesrɛ mo yɛda mo ase bebree.
At the same program, the deputy for NHS England, Miss Adana Williams, also engaged the media.
And development, particularly for autism, learning disabilities, and SEND. And just before I came here to Ghana, I was also asked to look at oversight for my region for mental health care as well. So, because we understand that all of these are interlinked and they complement each other. And if you're looking at care in one area, you should be looking at how you can enhance care across the board. So this is what we are hoping to do. So our key theme in the UK is about looking at collaboration. So that's one of my favorite words. We also recognize that there are a number of people with autism, learning disabilities, or both who are dying very early from preventable illnesses. And I'm talking about things like constipation. People were not getting basic screening for dental care, eye care. They weren't having audiology tests. They weren't getting basic care for us in the UK. They weren't getting that. So they were looking at how we could also improve that screening and improve services around it. We also recognize as well that we needed to have that collaboration across health, social care, and education. And just like Dr. Marble said, same problem we have in the UK. We needed to have people with specialist skills to provide those interventions. So we started looking at a whole workforce transformation piece. And absolutely, we couldn't do it without families because they are the experts of their loved ones. They know them best. They know the things, they know the triggers, but they also need that support to understand what they're looking at and where they should go to get that help and support.
My name is Adana Williams and I work in the NHS, the National Health Sector in the UK. My role is Deputy Director of Nursing for Professional and Systems Development, but I also have the privilege of being the Southeast Region Head of Learning Disabilities and Autism and Special Education Needs. And I'm here in Ghana, delighted to be in beautiful Ghana, to support the Reyo Foundation with their work on increasing awareness of autism, learning disabilities, and special education needs here in Ghana for the Autism 2-Day Send Show. And what I hope is that we would be able to raise awareness, encourage our local government and local areas to build, support, and increase access for this important area of care, and also to help make a more inclusive community and culture. And I love Ghana, and there's already amazing work happening in this area, and we are here to showcase, highlight that, and to bring learning from the UK here to Ghana as well. I'm one of the keynote speakers, and I will be speaking about the work that we are doing in the same area in the UK and talking a bit about how we can apply some of that learning from the UK here in Ghana. This is my fourth time in Ghana. I love it here, and my hope is one day to actually live in Ghana. I think it's amazing. The warmth of the people, the wonderful food, the fact that you're so inclusive and accommodating, and I do believe as well it makes me feel like I'm closer to my own heritage when I come to Ghana, and I just love everything that you are doing here because you are people of innovation.
I'm I'm a behavior analyst and the co-founder of Autism Compassion Africa. I'm here today at the Send Show to talk about autism. It's a 2-day event, and yesterday I was able to give a talk about behavior management and using applied behavior analysis to decrease challenging behavior and increase pro-social behavior. About this program, I've been coming to it since 2018, so it's great to see that it's back in full force, and the important piece about this program particularly is it's not just for professionals, it's not just for parents, it's a mix of both. So you have teachers here, you have university students, you have different parents that are here to learn about strategies that they can do to support their children. In Ghana, there's a lack of capacity when it comes to professionals, right? And so this event today and yesterday is about empowering parents, giving them strategies and things they can do at home to impact their child's development, and really pushing and encouraging early identification of autism and getting that early intervention support. Some of the things that I learned during the course of yesterday, we had this amazing talk by a young autistic man named Paul, and he talked about how autism is a fruit salad, and he was describing this view of how autism is not just one thing. There's so many different components, and it's very important that we look at the environment, we look at different mental health aspects, we look at what best helps that person learn. And every child on the autism spectrum is an individual. So I loved hearing him talk. He got me inspired to learn more about that approach. And I think it's very important that we as professionals listen to autistic voices and take their feedback and help guide our way forward to working with children with autism. This program, I've been attending since 2018, it's 2023, and it's definitely been growing. They had a version of it last fall, and it was really encouraging to come this time and see more parents, more professionals. I love how they have the telehealth learning aspect. You know, there's many people who want to come and attend, and they're using technology to get more people involved for learning, but also for presenting. Many of the presenters are in the UK presenting via Zoom as well. So adding in that technology piece helps this conference just go even further, and I see that in the future that will only grow and continue, and I wish them all the best and hope to help in any way I can.
Renate, and I'm the Executive Director for African Dyslexia Organization. African Dyslexia is an organization that champions awareness, advocacy, and giving support, as in training support to teachers to be able to teach dyslexic learners. Today I happen to be here at the Autism Show, and I came to convey the message to how important it is for educators to be aware that we have 4 different types of learners in the classrooms, and therefore we have to find the ways that we can teach all learners to be.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.